I am Leah Bachani. I am your holistic health and hormone coach. And I've brought to you today another amazing guest expert, Dr. Nafisa Parpia. And she's actually the director of naturopathic medicine at Gordon Medical Associates in San Rafael, California. I'm going to tell you a little bit about her background and then we're just going to jump right into it because I know she has a huge wealth of information to share with you today. But she has been basically focused on treating patients with complex chronic illnesses. And Dr. Parpia specializes in very complex situations, Lyme disease, tick-borne illness, environmentally acquired illness, mold. I could go on and on. She deals with like some, really important big stuff. And she uses cutting edge laboratory tests and deep intuition applied to a full range of scientific data. My goodness, I'm getting so excited. I can't even pronounce all the things you do. But you know what, Dr. Parpia, let's just cut to the chase. You help people, especially women, with complex medical issues. So thank you for being here. And today we're actually going to talk about some of those things.
Thank you so much for having me. And I just want to say thank you also for doing this summit. You've done it twice now. And I think this is the first generation of women who are 40 and above that are finally getting attention. We're finally being told, you know what? You don't need to age in a way that makes you feel less than, in a way that takes away your self-sovereignty, your self-power. You don't need to age in a way that makes you feel exhausted, that makes you feel less attractive anymore, that makes you live with less sleep, makes you live with more pain, right? For so long, women have been told, you know what? You're aging. Just accept it. This is how we age. Just sleep well and eat well. If they're lucky, they're told that. And here, have an anti-anxiety medication. But now, finally, there's hope for women because there's people like you, myself, and all the other wonderful people you've interviewed here to tell women we don't have to age this way. No way. There's more for us.
There are answers out there. You're right. And you just validated all the women watching. We're like, oh my God, I feel seen. I feel heard. And, that's why we're here because, as you said, Dr. Parpia, like for so long, women have heard it's normal. It's just menopause. You'll just get through it. And you're right. They don't have to suffer. So today, we're going to talk about metals, menopause, and chronic illness. And that actually encompasses a lot. So I don't think we'll get to everything because I'll need like 50 more hours with you for that. But you're a busy woman helping other women get better. So let's talk first about what we can talk about in a shorter amount of time. Um, where would you like to start with this, Dr. Parpia? It's a complex issue.
Yeah, let's start with how lack of hormone has an effect on our immune system. So
Yeah.
hormones do have very important roles in our immune system, and women might actually start to notice this as they go into perimenopause. Maybe they're 35 and their hormones start to act a little bit wacky, and then they're in their late 40s and their 50s and the hormones are depleted. They're going to notice issues in their immune system. A lot of women might get a diagnosis that's autoimmune in nature, like Hashimoto's or rheumatoid arthritis or even lupus. We see this happen. Or women might notice that they're inflamed. What does that look like? Well, she might feel like she's losing her mind. She might feel like she has brain fog. She might feel like she has gastrointestinal issues, sleep issues, aches and pains. That's about inflammation and oxidative stress in the body. Or she might notice that her body is more permissive to common infection. She's always catching colds. So all of this is true because when we are low in hormone, we're more prone to inflammation and oxidative stress. Our CD4 T and B lymphocytes are not working as well. Our natural killer cells aren't as active. So it's absolutely true that we're more prone to infections. We're more prone to inflammation and oxidative stress and everything that goes with rapid aging. And we're more prone to autoimmune conditions. This is shown in the research. Absolutely, the research agrees. And it's shown in my medical practice. I see this happen on the daily with my patients. It's just not talked about enough. So this is the time for us to bring these issues to light and to give people hope. Yes, there's hope. You don't have to live like this.
Yeah, so what you're saying is that when our hormones naturally decline in that perimenopause stage, then we're more susceptible to to having these type of symptoms show. And if so, what can we do about it?
So I'm a strong believer in bioidentical hormone therapy for people, for most people. Not everyone is a candidate. If you've had cancer like breast cancer or ovarian cancer, uterine cancer, if you have endometriosis, you're not a good candidate for any hormone therapy. But when we use bioidentical hormone therapy, it mimics what we naturally produce. It's made in the lab, made in the compounding pharmacy where everything is clean. There's no fillers, no additives. And women notice when they have their bioidentical hormones, they're loving life. I mean, I can't tell you how many women I've given this to, and they said, why didn't you give this to me earlier? I feel so much better. I feel healthier. I feel stronger. I feel happier. This is how I should live. So that's a simple way to make a change. But there are some people, you give them their hormones, you fix their microbiome, because the microbiome is also very important here. I'm sure you have people talking about that, and still they have some issues. Those are the people who have chronic illnesses, and we can get into that. But for the majority of the population, bioidentical hormone therapy is a great first step.
Okay, so what I hear you saying is we do a foundation for women. So, microbiome, so your gut health, a healthy diet, reducing stress, working on sleep. And when you get that foundation set, then maybe adding in some bioidentical hormone therapy or at the same time. And that helps many women, but not all women. So women might need to address more issues if that's not helping them feel amazing. And so let's go there.
Okay, so the way a woman is going to respond in menopause, it's variable, right? Some women, you just fix their hormones, you fix the foundations of their health, and life is great. Okay, life goes on like normal. Other women, you fix the hormones, you work on the microbiome, and there's still some issues. So what I'm going to do is backtrack a little bit and talk about the different diagnoses that can cause women to feel mysterious symptoms that can mimic menopause. So I'm just going to dive right in and talk a little bit about Lyme disease, because this is something that I find underneath a lot of mysterious symptoms. So tell everybody a little bit about what Lyme disease is. So
Yeah.
first of all, it's kind of controversial in a way, because some people say there's no Lyme in California or on the West Coast. That's just an East Coast thing. Well, let me tell you, I've had patients from all over the world and all over the country. And of course, people from California, where I am locally, where you are locally, come to me with Lyme disease. So it's common. It's all over the place. Now, Lyme disease it's when a tick bites a person. So imagine here's a tick, it bites the person, and then it can transmit different infections. Lyme disease is one of them. Different bugs, so Lyme, Bartonella, Babesia, Ehrlichia, Rickettsia, for example. So these multitude of infections can be passed on to us via a tick bite. Now, we should be able to live side by side with these bugs. That we absolutely should be able to. Our immune systems should be able to handle this. But there are times when people's immune system can't handle such a thing. It could be, and I'm not going to say could, it's very, very often I have women in menopause. They come to me because now all of a sudden they're sick. Okay.
Mm.
They've got symptoms of menopause, but symptoms that can also resemble tick-borne disease, like Lyme disease. So brain fog, sleep issues, mood issues, aches and pains in the joints and the muscles, gastrointestinal issues. They feel like every system of their body has been hijacked. So, most women, before they come to me, they've been to a good naturopathic or a good functional medicine doctor. They've had their hormones balanced. Maybe they haven't. They've had their microbiome fixed. Maybe that hasn't happened either. but usually they've had these things happen, or they've had these things corrected for, but they still have aches and pains. They still have brain fog. What's going on here? That's when we need to cast a wider net to look for other diagnostics. And this is way more common than you might realize, Leah. So I'm casting other diagnostics. Of course, I'm looking for tick-borne disease because I'm seeing that these symptoms resemble tick-borne disease. And so it's very often that now a woman is in menopause and her immune system isn't as optimal as it used to be before, like the reasons we talked about. There's increased oxidative stress, there's increased inflammation. Her natural killer cells aren't working anymore. Those are the cells that recognize and kill infected cells. That's not happening as well anymore. So then the infection that she had, the bite she had 10 years ago might be showing up now. All of a sudden, a woman is in chronic Lyme and she didn't even know she had it in the first place. And this is just too common.
Wow. So you're saying we could have been bitten a decade or two ago, and our system, our immune system, kept it at bay. But now that our hormones are decreasing, which supports our immune system as well, it's just not functioning as optimally. And those viruses are rearing their ugly heads.
Exactly that.
Oh,
Yes.
yikes. Okay, now we've got all the attention of the women listening that, and it's very interesting too that the symptoms can mimic the same as menopause or perimenopause. So you really probably do need a test, right, to know what you're dealing with.
You need to test. So I
Yeah.
want to talk about why these symptoms mimic. I mean, it's very, very interesting, right? So I talked about inflammatory cytokines. That's become a hot word now, two hot words, inflammatory cytokines in the pandemic, right? Because we know that COVID increased, or it increased the propensity of our body to create more inflammation, more inflammatory chemicals in our body, right? So now tick-borne diseases like Lyme disease will also create that heightened inflammatory process in the body. Well, menopause, due to lack of hormone, can also increase that inflammation in the body. And there's research that shows that. And I can measure that. I can measure people's inflammatory chemicals. I can measure their hormones. And I also look at their genes of detoxification, their genes of their endocrine system, their genes of their inflammatory system. We're pairing all of these tests together to see what's going on in the person. But we get more inflammation in both menopause and in Lyme. And we get more immune dysregulation in both menopause and in both Lyme. So whether a woman is in menopause or not, if she has Lyme, there's a higher propensity for autoimmune diseases like rheumatoid arthritis and Hashimoto's. You put those together, we're going to have even more immune dysregulation and even more inflammation. And that's why the symptoms can mimic each other. Symptoms, again, like brain fog, fatigue, sleep issues, hormonal issues, pain.
Mm,
Yeah,
that's awful. So I guess a follow-up question that maybe a lot of women are wondering is if you can you address let's maybe it is a Lyme issue and maybe there's some fallout based on that of Hashimoto's or another autoimmune disease. If you address the Lyme and the inflammation, perhaps the hormone imbalance, can you actually heal your autoimmune issues?
absolutely. Absolutely. Every day I see people heal from Hashimoto's or rheumatoid arthritis. The interesting thing is in 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 the world of medicine, when people are given a diagnosis that's autoimmune in nature, usually they're just given a steroid medication to keep it at bay. They're told there's really not much you can do about this, but have some prednisone. Now, prednisone can help a lot of people. Steroids really can help a lot of people, but they're not working on the root causes. And I think that's really, really important because the research also does show that there are certain chronic infections. When I say chronic, I mean a person has an infection chronically over a long period of time that can create autoimmune conditions. Environmental toxins can create autoimmune conditions. So I'm looking at the different reasons why my patient might be having an autoimmune condition. Often it includes Lyme and its co-infections, but it can also include parasites. That's common. It can include mold issues. It can include heavy metals like mercury and lead, or microplastics, glyphosate. So it's usually a combination of infections, toxins, trauma. A lot of people have had adverse childhood events, traumas early on, or they're in trauma right now. Maybe the trauma of being sick, or maybe trauma in a relationship. Well, trauma causes immune dysregulation. So it's this perfect storm of these issues plus the genetic propensity. And you put those things together, and that's what then can bring about these the wastebasket diagnoses, like certain autoimmune conditions or fibromyalgia, chronic fatigue syndrome. They're wastebasket diagnoses because really that means it's an I don't know diagnosis. Yeah, you have these symptoms, and we can put you in this basket to say you have this diagnosis, but we don't know why, and we don't know how to treat it. Just like menopause, I don't think that's right. I think we need to dig deeper and find out why these people are having these illnesses, what's causing the immune dysregulation. And so that's what I do on a regular basis. Now, if it's someone who's having some symptoms, I definitely don't want to go chasing that diagnosis first. Absolutely not. So first, I want to correct for the hormones. First, I want to work on the microbiome, right? Circling back to the beginning of our conversation, working on the things that, probably are going to fix the issue. Then we need to look for other diagnoses if the autoimmunity isn't being recovered, if the chronic fatigue syndrome isn't being recovered. And that's when I start to find these other issues.
Yeah. Wow. There was a lot to unpack there. And I think that many women watching right now we're used to the conventional medical system now where you go to a doctor, you get a diagnosis, and you probably get a pill or two, prescription. And what you're saying is actually completely opposite in the sense that that's just a band-aid for many cases. I'm stereotyping, I'm generalizing here. But in many cases, women are leaving the doctor's office and they're not getting the answers. They're not feeling amazing. They might feel better, but they're not feeling amazing. And so you're saying, we're going to peel back all these layers and we are going to find the root cause. And before you may not even, you may be on this journey for a while, building a foundation of health before you find the root cause. Is that what I'm hearing?
Absolutely. So, and it's usually multiple root causes. In fact,
Mm.
when someone has become my patient, it's not just one root cause, but it's so many different causes. Like I was saying, multiple infections, multiple environmental toxins, multiple stressors, issues in structural integrity. Maybe their tissues are too tight and there's not enough lymphatic flow. There's not optimal blood flow to certain areas. So multiple different issues going on all at the same time. Now, even if someone had just one of these issues, say they had chronic Epstein-Barr virus, right? Over time, that's going to create inflammation, which could lead to autoimmune conditions. Absolutely. But imagine you have all of these different layers of root causes going on at the same time. It's been going on for quite a while. That can create pandemonium in the immune system, and
It's
it
like a
does.
domino effect.
Yeah, yeah. And so I want to make sure that as I'm speaking, people don't feel fear. I want to make sure that you feel relief, okay? Because there are answers out there. There's
Yeah.
possibility there.
Well, and one of the most amazing things I heard you say, and I also use this in my practice, is that even if you don't know the right answer, I mean, there's no one right answer. When you're doing these small steps towards foundational health, maybe you're cleaning up your diet, maybe you're working on your hydration and your sleep, and you're taking the toxins out, and you're working on your microbiome, your gut health, your stress. All of these things are things you need to do anyways that are going to help you on this journey to finally kind of figuring out, okay, what are the root cause or causes? So everything women, if you're a woman watching right now and you're like, well, I mean, was it a waste of time to work on, my gut health or this? Right? No, what you're saying is all of this is foundational and highly important to do anyways. So
Yes.
anything you take is in the right direction.
Yes. I love the way you just wrap that up. I mean, that's absolutely, you said that so well, Leah, because a lot of times people might say, but I still don't feel well. My hormones are corrected for. I saw a good naturopathic doctor and functional medicine doctor. They worked on my microbiome. I still feel bad. Well, those are the foundations for your health. And they're important because if I want to come in and bring in some more complicated therapies, they're not going to work very well until we have the foundations of health set. So all of that work was not done in vain, even if you still don't feel quite right.
Yeah, I love that. It's kind of one of the analogies I think about sometimes is, the big ball that drops from in the Times Square on New Year's Eve? Like everyone's so focused on the big ball. It's shiny, it's pretty, we're watching it. That's like the ultimate attention focus. But to get that big ball up there, they had to build all the foundation first. And even though we're all focused on the top shiny object, it wouldn't be there. We wouldn't get there if we didn't have the foundation. So, maybe your diagnosis is the shiny ball, and it'll feel really good when you have a label for it finally, but you can't get there if you don't build the foundation.
It's interesting you talk about shiny objects because sometimes a lot of my biggest therapies, I call them my shiny toys, my shiny objects in my tree. It might be intravenous therapies or peptide therapies or you know, all kinds of different techniques we have actually. But those shiny objects, the big guns in therapies, a lot of times people don't even need them. I want to bring out my big shiny objects until I've got the foundations right. And then if we need the big fancy treatments, you know, they're actually going to work better.
Yeah. And
Yeah.
I encourage all the women, what I'm hearing you say too is something that I have many conversations with my clients about. The foundational work that we're talking about here, it doesn't always feel sexy. It doesn't feel great. It's not an immediate gratification in most cases. It's work, it's consistency, it's showing up every day and doing the things, and you don't often get that. The needle doesn't jump right away for many people. So I think that what I'm hearing you say is it's still highly important. We still have to do it. And then we can also throw in the shiny objects if we need to,
Right.
where they're needed. Yeah.
Mhm.
What about, I mean, there's a buzzword also about detoxing. Can we talk about, because you mentioned toxins causing inflammation, hampering our immune systems, our hormone balance. Do you suggest people detox? And what does that mean?
That's a huge question. And I'm going to break that question up into different pieces because I have a big focus on environmental medicine, actually, which is detoxification therapies. It's one of my shiny objects. Speaking of those, but I don't know if you have heard me speak about pre-tox. We need to make
Hmm.
sure that people are ready to detox before we do that. But I actually want to talk a little bit about lead
Okay,
and menopause because that's going to lead into the conversation about detox.
let's
So
go there.
yeah, so women in menopause and perimenopause tend to have higher levels of lead in their blood. You might be going like, but how is that possible? Because lead's been banned. It was banned in paint in 1978. It was banned in gasoline in the 90s. So like, how can we have lead in our blood? And why in menopause it just doesn't make sense, right? But here's how. So lead doesn't biodegrade. It just runs off, right? Precipitation, runoff, it just gets transferred through the environment. There's lead in our drinking water, there's lead in our food, and well, we get exposed to it. When we get exposed to it, it goes into our blood, and then where does it go? It goes into our bones. It gets stored in our bones. And it's kind of a safe place for it to be stored until it's not. Okay. So then we start to lose bone. when we have when we're in perimenopause, and when we're in menopause, some of us even get a diagnosis of osteopenia or osteoporosis. And then as we start to lose bone, the lead that was stored in the bones, it leaches out into our bloodstream. And then we can become our own source of lead exposure. And this sounds far-fetched, but Leah, it happens so often. Anybody who is 35 years old and older in my practice gets screened for blood lead. And I have to say, at least 50% of my practice has levels of lead that are considered unacceptable in the blood. So this is really, really common. No one's thinking about it, but it's common. And I know it's common because I see it every day in my patients. So what do we do about that, right? Like, do I want to detox the lead now? Not yet. I want to stop the bone loss because I could detox the lead out of someone till the cows come home. But if they're still having osteopenia or osteoporosis and they're losing bone and leaching lead into their system, I'm going to be detoxing them forever. That's a waste of their time and their money. That shouldn't be done. So we've got to stop the bone loss first. Then we can remeasure the amount of lead in the blood, in the urine. Maybe we do another test where we can, a chelation test where we can understand what the body burden is of lead, like how much lead does get pulled out of the body when we provoke it out, gives us an idea of how toxic the person is. So that's one example when I wouldn't want someone to detox just yet. They're not ready for detox.
So they need to pre-tox.
They need to pre-tox.
I like that. I haven't actually heard that term. That makes a lot of sense.
It's a term that I coined actually specifically for complex chronic illness. So there was a naturopathic doctor. I don't know who she is, but I did hear recently that she did use the term pre-tox a while ago to talk about before we actually send a patient through a detoxification therapy, we need to support the organs of elimination, the liver, the kidneys, the gut, the lymph, because those are the routes by which the toxins are going to come out. So that's what she was talking about. Now, when I started talking about pre-tox, probably 4 years ago now, it's something I thought about a lot because I noticed a lot of patients were coming to me and they said, you know what, I detoxed and it was the worst thing I ever did. It made me feel sicker, or some people say it did nothing for me. People had to quit. And why is that? Well, there could be issues that make detox premature. For example, if somebody has gastrointestinal issues, say they're prone to constipation, and we're pulling toxins out of the cells that we then want to flush out. If a person has constipation, the toxins are just going to recirculate. If a person is prone to loose stools or diarrhea, the gut's inflamed. We send toxins through the gut. When it's already inflamed, it's going to aggravate it more. Some people are prone to urinary tract infections. Often it's women post-menopause because they don't have enough hormone. That's another issue with women in menopause because of not enough hormone. Well, if you have UTIs and I'm trying to detox you and we've got toxins coming through your urinary system, that's going to make you feel worse. So we have to set the stage, get the system ready for detoxification, because I consider detoxification medical in nature, and it's got to be personalized for each human being I'm working with. So working on bioidentical hormone therapy, working on the microbiome, working on the different systems, preparing them for detox is something that I do commonly.
Yeah, and just to be clear, because detox is a huge buzzword, I want to kind of define that just for a moment for all the women watching, because you can correct me if I'm wrong, but I have a feeling that your detoxification process is a little bit more medical in nature, a little bit more robust, let's say, versus like you can do a safe, gentle daily detox simply by hydrating more or eating more greens or drinking lemon juice in the morning or taking your spirulina. So let's just define that there is a difference. There's a whole spectrum of detoxing.
And there sure is. So what you were talking about, that's gentle, that's safe. And to me, that should be everyday living, sweating, sleeping properly. When we sleep, our brain detoxes. That's called our glymphatic system. We need the brain to detox too. Our body can detox better when we're sleeping well. We've got to be eating organic. We have to be hydrating. We have to have clean products, right? So that that kind of detox, I'll even call it just the way we should be living.
It should just be a daily routine.
Yes, yes, and people need help with that.
Yeah.
People need help with just that daily routine, and
Oh, I
even
know.
what you help people with every day,
That's what I do all the time.
right? And then what I do is I measure, well, what's your toxin load? Do you have glyphosate as a problem? Is lead a problem? Is mercury a problem? Why do you have all this immune dysregulation? Let's do these tests. Then, do we have a burden of toxins in our cells? So environmental toxins like microplastics, glyphosate, insecticides, fungicides, they bioaccumulate in the cells, in our fat cells for the most part. So I'm often doing therapies to pull those toxins out of the fat cells. Heavy metals, lead bioaccumulates in the bones mostly. Mercury, cadmium, arsenic, aluminum, other metals, they bioaccumulate in the cells of our organs. Could be the thyroid, could be the kidneys, the liver. So sometimes I'm doing detoxification therapies if it's warranted, if it's the right thing, where I'm pulling the metals out of people's cells. And then after I'm doing that, I'm making sure that all of the organs of elimination are ready to handle this load of toxins that we're pulling out of the cells. So the day-to-day detox that you're talking about, that's not a cellular detox. That's making sure that we're not accumulating further toxins in our body. And it's making sure that we are flushing out gently the toxins that we're exposed to on a day-to-day basis. But the detox that's medical in nature is cellular detox.
Absolutely. In fact, I should probably say right now, for those of you watching, I did another interview with Dr. Wendy Trudeau, and she talked about actually removing the toxins from your life. And I think that would be a really great interview to watch alongside this one because they go really hand in hand together because part of detoxing is removing the toxins too.
It's a
So
huge part. In fact, I'm not going to engage in any medical detoxification therapies until I know the acute exposure is gone.
yeah,
Otherwise, we'll be detoxing forever, and it's just not fair to the patients. We've got to remove them
yeah.
from the exposure first.
It's like pouring water in a bucket with holes in it. Like you're
Right.
never going to collect it. It's just
Right.
going to keep going.
Right. And I love Wendy. Wendy and I are good friends, and
Oh, yeah.
we've interviewed each other and had
I
fun
was
with.
just thinking how amazing these two interviews go together and how much knowledge women are going to get from watching both of these together. And so, like, I know also your time is coming to a close. I wish I could have you for 50 more hours. There's so much I want to dig into here. But for the women watching that maybe their mind is like doing somersaults right now and they're like, oh my gosh, do I need to go see a doctor like Dr. Parpia? Where do I start? What do I do? Do you want to just kind of leave them with a closing thought on that?
Absolutely. So the first place to start, if you're looking for a doctor, is start with a really good naturopathic or functional medicine doctor. That's the entryway in. Okay. Naturopathic and functional medicine doctors are trained in bioidentical hormone therapy. We're trained in the microbiome. We're trained to look for root causes. Now, if you've worked with a great naturopathic doctor, a great functional medicine doctor, you've had these things corrected for, and still you don't feel right, that's when you want to come to someone like me. So I focus on environmental medicine. I've had a lot of training in environmental medicine and Lyme disease training. You find doctors like me at ICI, that's the Environmental Society of International Society for Environmentally Acquired Illness. I'm on the board of directors of ICI in ISEAI. We train doctors actually on how to think like this, on how to work like this, or a doctor who's trained by ILADS. That's the society that trains doctors to treat Lyme disease. And ideally, you might want to work with someone who's trained in both environmental medicine and Lyme disease. That's when we go deeper than functional medicine, but using functional naturopathic medicine as our foundation. But you've got to start with other avenues before you want to come to come to places where you need more intensive treatment, that's for sure.
Yeah, I love that. And so much information that you shared here. And I'm so grateful because for everyone watching, when you empower yourself with information, you can advocate better for your health. And then you can take the next step and the next step and the next step, and you will get to be where you feel amazing. It is a result you can achieve. You need these tools and these resources and this information. So I'm so grateful you brought that here to all these women watching.
Thank you so much. And my parting words to
Yeah.
the women watching, I want you to know there's hope. Right? If you've got these symptoms that are chronic, there is hope. We turn them around every day. It's it takes some time. Okay, it's not gonna be a quick fix. There's no such thing as a quick fix, but we work with you. We make things happen. So I want you to have hope. That's my main thing. And then Leah, I want to thank you for doing this. I think it's so important because we're able to get information out to women that was never available to them. So thank you for doing this and for all of your work.
Oh, thank you. The more we can empower, the more we can change the world. Oh, and I forgot to tell people, ladies, don't go anywhere yet. Dr. Parpia has a free gift for you too, and it's incredible. It's a pre-tox protocol, a guide to preparing your body for detox. Did I get that right, Dr. Parpia?
Yeah,
Yeah.
exactly. Yeah.
Okay.
Yeah. Great. And then you can find me at Gordon Medical. I'm in the San Francisco Bay Area. People come to our clinic from all over the world, all over the country to help with their complex and chronic health issues.
Amazing. So I will put that link for all of you watching. Thank you so much, and I'd love to have you back. This was incredible.
Thank you so much.